Hi, Dr. Gullberg. Continuing our infectious disease lecture series. Today we're talking about travel advice, international travel advice, some pearls of wisdom from our international travel clinic. I think you'll find helpful. So we talk about primarily immunizations, and then we talk about pills or meds that we need to prescribe for people. So let me just go through some of those issues. In terms of shots that we recommend, updates in tetanus is number one, generally every 10 years. We recommend for most people when they're going to a developing country, we recommend a hepatitis A vaccination or gamma globulin if they just want short-term protection, for 6 months. Thirdly, we recommend typhoid fever protection, and this can be through a oral live vaccine called Vivatif, or through, that's good for 5 years, or the shot, which is good for 2.5 years. Very safe. Yellow fever vaccine is recommended for people traveling to the Sahara area of Africa as well as the equator of South America. Generally very safe, produced by the U.S. government, and lasts for a lifetime. Meningitis vaccine is recommended for people that are in the Sahara area of Africa, like Kenya, for example, in those regions. Hepatitis B vaccination is recommended for people, especially in Southeast Asia, protection from blood exposure, especially or through sexually transmitted disease. Inactivated polio vaccine is recommended for certain countries. Polio is still a problem for several areas in the world, like India, Africa, Israel, that type of thing. So you still have to watch for that. And then Japanese encephalitis vaccine we recommend for people traveling to Southeast Asia for more than 4 weeks. In terms of meds, we always give people medications for travelers' diarrhea in case they get Montezuma's revenge. We usually use Cipro, fluoxetine in adults, or rifaximin, but there's other medications that are very helpful. And of course, in children, we have to be careful with not using any quinolones. Malaria medications are generally going to be chloroquine in Central America. Otherwise, in most areas of the world, we're going to use drugs like mefloquine weekly or Malarone daily while they're in their destinations. Mefloquine is the medicine that's associated sometimes with psychogenic side effects. Jet lag medications are sometimes utilized for people going over a lot of time zones. We'll use meds like Ambien, but we also go through natural things you can do to prevent jet lag. Lastly, if they're going to high altitudes, we'll prescribe Diamox for them, especially if they're going to places like Machu Picchu or someplace like that, Nepal, etc. So this is just a nice summary of what we go through in our international travel clinic visits. Hopefully it'll help you as you talk to people about their travel. Thank you. Dr. Gullberg signing off.